How can I advocate for my loved one in the doctor's office? You're sitting in the waiting room, heart racing, notes in hand, but when the doctor walks in, you freeze. You see changes that worry you, but somehow the words feel heavy or awkward. If you want to step into that exam room with confidence instead of anxiety, this video is for you. We're going to cover how to prepare before your appointment, how to speak clearly and assertively during the appointment, what to ask, and how to follow up afterward, so you don't leave important things unsaid or unclear. I'm Dr. Anna Thomas. I'm a physician, TEDx speaker, founder of Life Care Leadership, and I believe that every caregiver deserves to be heard. I created this podcast, The Age of Caregiving, to give caregivers like you the tools, structure, and support to lead care with clarity. Whether you're navigating a new diagnosis or you're juggling care on top of everything else, please remember you are not alone. Everything that I share here is for educational purposes only. Always consult your healthcare provider for personal medical advice. And if you're juggling work, life, and caregiving, and it feels like burnout is always around the corner, check out my book, From Caregiver to Care Leader. It's a blueprint to help you balance it with clarity, systems, and confident care leadership. You'll find it now on Amazon. The link is below. Let's talk about your steps. Before the visit, you need to prepare. Review your log, note any changes, symptoms, or concerns. Write down your top 3 essential questions. Don't overpack it. What are the 3 most important things that you need answered before you leave the visit? Bring with you your care binder, any lab results, medication lists, up-to-date medication lists, and any other relevant medical documents. Decide before you go into the room who is going to be leading the questions and the discussion. Is it going to be you, your loved one, or is it going to be a little bit of back and forth? Allow extra time before the appointment if you get a little bit nervous talking to the doctor. Preparing yourself gives you clarity. It helps you stay focused in the moment. Step 2, you want to have a structured approach in the visit. One effective structure is the PAQ, problem, ask, quantify. Here's the problem. I noticed more frequent confusion and falls over the past month. Ask, could this indicate progression? What are some tests that should help us understand this? Quantify, this happened 4 times in the last month. Here's another technique. Take notes as they're speaking, pause and ask for clarification, and ask them to summarize next steps back to you one more time. Ask them also for written instructions if possible. Step 3 is to ask empowering questions. So here's some questions that you want to keep in your toolbox. What changes do you think are most concerning right now? What is the goal of this treatment? Is it improving, stabilizing, or focusing on comfort? What are some side effects or risks that we should be watching out for? How will we measure if things are improving? And what should we do if it's not working? When should we revisit it? When should we come back? And is there a next step if things are not working with this treatment plan? Like, what is the next step after that? Asking shows you're engaged and gives context to follow-up care. Let's talk next about asserting your role. Doctors might default to treating the patient, and I understand that, but you want to remind them that you're involved in coordinating the care. So it's important for you to understand all of the different details because you're the one that's going to have to implement it when you get back home. So you might want to ask, I'd like to make sure I walk out knowing exactly what to watch out for, what to expect. And if I need to call between now and the next visit, what's the best way to get in touch with you? When you're advocating for yourself as a caregiver, it's not confrontation. You're becoming a clear partner in the care situation. Step 5 is follow-up. So after the visit, make sure you have instructions, what was decided, what you're supposed to do next, and what the follow-up plan will be. Make sure that you put those down in your calendar and you share key points with other family members who are involved in the care plan. After the visit, make sure you do schedule that follow-up appointment. Remember, your voice matters. Don't leave the appointment with any doubts as to what to do next. In my book, From Caregiver to Care Leader, it gives you frameworks and language to advocate for yourself clearly in the doctor's office, as well as in other settings, such as at home or in the workplace. You can check it out on Amazon. Remember that walking into that exam room can sometimes feel a little loaded. You're bringing all the knowledge that you have at home, and now you're not just a bystander. You're seeing the changes, the patterns that sometimes tests don't show. And when you speak up, You become the anchor that your team needs and that your loved one deserves. If you haven't already, check out this video to get more additional information about how to advocate for your loved one. Remember, you are more than just a giver of care. You are a leader of care. This is the Age of Caregiving, and together we can lead with strength, confidence, and clarity.